Hello everyone, Dr. Romar Rochet here. In today's video, I wanted to talk about one of the most common subluxations that bring people into chiropractic offices. Now, most people come to a chiropractic office because of back pain, low back pain, sciatica, hip pain, knee pain, even headaches and neck pain. Most of those symptoms have a common cause, and that common cause is an AIS sacrum. Now, an AIS sacrum is what happens to the sacrum, the triangle-shaped bone at the base of your spine, when it goes forward and down on one side. And that disrupts the foundation of the spine because you have your entire spine stacked on that sacrum. Your right and your left hip are attached to the sacrum. And so we refer to the spine as a kinetic chain. Kinetic means movement, chain being connected. So everything in the spine is connected through movement. So this person came in severe low back pain. He had the classic presentation of it being focused and centralized in the middle part of his back. He had the butt pain. He had some radiation going down into his legs. He had some knee pain, and he had some headaches. And these are all years in the making. He works in the equestrian community, so you can imagine the physical stresses associated with his work. And the reason why I want to focus on this is because this subluxation affects the movement and the function of the entire spine. There can be subluxations above, especially at atlas, which cause compensatory changes down low. Well, atlas's sister is the sacrum, and when the sacrum is off and subluxated, it will cause compensatory changes above. So as you can see from his x-rays, we have an AIS sacrum. How could we tell? Because the image doesn't show a flat sacrum. It shows a twisted sacrum. And then when you look at the hips, you don't see equal wings of those ilia. You see one narrow and one wide. That is a classic presentation on x-ray of a AIS sacrum with counter hip rotation. And that starts to affect the spine from L5 up. These people usually have discs that are bulging, some herniated depending if there's trauma involved. And they usually have headaches to go with because the spine is rotated and has to fall, and then there's a compensatory change, and now I'm sitting with a lot of pressure on my brainstem through atlas. And the same goes down, because as those hips turn and rotate, now I'm dealing with one leg longer than the other, not just in length, but also in rotation. And that places an inordinate amount of stress on knees, which tends to produce things like meniscal tears and collateral ligament strains because the pressure on that joint is now greater due to an AIS sacrum. So as an update on this client's care, we are currently blocking him every day. Pelvic blocks are meant to untorque the spine. We do those blocks after we do our adjustments to correct the subluxations that are present. And he has gone from not being able to work, bent over, in pain, can't sleep, to it's been a couple of weeks now and he's back to work, he's back to fishing, he's sleeping well. We're not out of the woods yet because, again, this is a severe case of pelvic rotation that hasn't been dealt with in over 10 years. But he's getting his quality of life back. And yes, his headaches have gone away. All of this from correcting subluxations, and all of this from making sure that we're not just focused on subluxation correction, we're actually doing so through structural correction attention. I hope this was a blessing to you. I hope it gave you some direction in terms of your own healthcare. And if you are in the Royal Palm Beach, Wellington area, I hope that you would give us a call and give us an opportunity to analyze you, take some x-rays, and see how structural correction, subluxation-based chiropractic can best help you